Hello friends, welcome to a new episode of Drishti IAS Editorial Analysis. In this editorial analysis, we do three things. First of all, we link the editorial to the UPSC Civil Services exam syllabus. Secondly, we understand the key points mentioned in the editorial. And thirdly, we look at the important concepts that have come in the editorial and which are important from exam point of view. So let us begin today's editorial analysis. Today's editorial has been taken from the Hindu and it has appeared on 24th of April. The editorial's title is Protection for Protectors. It says, healthcare workers should be allowed to work in an environment free of violence and abuse. Now let us look at its linkage with the UPSC syllabus. So it links directly with GS paper 2, where we have issues relating to development and management of social sector services relating to health, education, human resources. So there it links with the health sector. Now let us look at the key points of the editorial. The editorial says that the healthcare workers should be allowed to work in an environment free of violence and abuse. And why the editorial is saying so? Because in the recent past there have been a lot of cases of abuse and violence against the healthcare professionals. And the editorial enumerates the cases of such abuse and violence which the healthcare professionals have been facing in the line of duty since the first case of COVID-19 was reported in the country. So the healthcare professionals who have been sent to collect samples from people suspected to be infected, they have been attacked. And this is so strange because the people are not realizing that these healthcare professionals are coming to save their lives only. But because of misinformation or ignorance, they have been attacking such healthcare professionals. And it has been sending a very wrong message to the society in general and in particular to the healthcare professionals who have been putting their lives at stake. Then the doctors returning home from duty have been prevented from entering their homes and in some cases even asked to vacate their premises. So the landlords have been asking the healthcare professionals, including doctors, to vacate the premises because they feel that these doctors can be carriers of the infection, without realizing that these healthcare professionals are the soldiers in this battle against this COVID-19 pandemic. So on one hand, the government is saying that these healthcare professionals are like soldiers and they should be respected, while on the other hand, what is being seen on the ground is totally different, where these healthcare professionals are being subjected to a lot of abuse and violence. And there has been this very obnoxious case in Chennai where few people attacked the healthcare workers and also prevented the burial of a neurosurgeon who had died due to COVID-19. And the editorial says that this has shaken the conscience of the nation. And because this neurosurgeon and many like him have been the front line against this war against COVID-19 and saving the lives of people, and in that process they have got infected, and if the society treats them unfairly, then it lowers the morale of all the healthcare professionals. So this is a very sorry state of affairs. After this incident and lot of hue and cry, finally the Union Cabinet has woken up and it has taken a decision to promulgate an ordinance to amend the Epidemic Diseases Act 1897. We'll look into this Epidemic Diseases Act and its features in the key concepts section. Now the editorial says that the Cabinet's decision to promulgate an ordinance to amend the Epidemic Diseases Act 1897 is commendable because it makes acts of violence against medical personnel a cognizable and non-bailable offence. A cognizable offence is one where no warrant is needed for the arrest, and a non-bailable offence also indicates that the offence is serious and bail cannot be claimed as a right in that offence. So it has made the law stringent. Secondly, it also provides for compensation in cases of injury or damage or loss to property. So this is a welcome step by the government, but only changing the law doesn't help. The mindset of the people also needs to change accordingly. Now the editorial has also listed out certain reasons for such attacks on healthcare workers. Let us look at that. The editorial says that mostly the abuse and violence against the healthcare professionals has been due to fear and ignorance. So this fear and ignorance, they have been the driving factors against this violence and abuse perpetrated against the healthcare professionals. Because of ignorance, people are easy to brainwash, and the fear makes the people indulge in violence. So both of these factors are playing a major role, and this has been the major cause behind the attack on healthcare professionals who have gone to collect samples from people who are suspected to be infected. Secondly, the editorial says that the communal color given to the COVID-19 epidemic after the Tablighi Jamaat case, which happened in Nizamuddin in Delhi, it also led many people in the Muslim community to avoid getting tested because they feared repression from the government authorities and they felt that they were being victimized. And the media's coverage of the event was also very problematic. Also, the editorial says that the fear of stigma and isolation resulted in attacks on healthcare workers who had gone to collect samples. So, this fear of stigma, this branding that he or she is a COVID-19 patient, they are carriers of this infection, and the forced isolation which is necessary, that has resulted in attacks being carried out on healthcare workers who had gone to collect samples. Also, the wrong messaging that getting infected by the virus means a certain death has also led to a development of fear psychosis among the people, and this has also been counterproductive. Now, as far as the scientific evidence goes, only 20% of the people who are getting infected by this COVID-19, they develop serious complications, serious enough to be hospitalized. And out of these 20% people, only 5% require serious medical intervention like ventilators. That more than 80% of the people are not seriously affected by the disease and hardly anything will happen. But the risk is infecting others. So that is why a lot of precaution is needed, and that is why isolation is needed. So this awareness has to be disseminated across the population for this fear to subside. Now, the negative messaging that induces fear and stigma is always counterproductive, as seen in the early days of the HIV/AIDS awareness campaign. So when this HIV/AIDS awareness campaign was launched, that was also having a very negative outlook. And till the time this negative messaging and stereotyping was not stopped, the HIV/AIDS awareness campaign did not pick up. So once this negative messaging was removed, the awareness building exercise became easier and more effective. So it is very important that this negative messaging stops. So what these doctors, nurses and other healthcare workers need from the public at large is compassion, unmitigated support, cooperation from the society, understanding their challenges and trying to help them by staying at home, by making sure that you are not infecting others, so the load on our healthcare system is less. So that is what is needed by the healthcare professionals. And the editorial at the end says that symbolic gestures are fine, which are in the nature of clapping hands or lighting candles in recognition of the selfless service by the healthcare professionals during these trying times. But for really bolstering their morale, it is very much required that we understand and support what the healthcare professionals are doing by trying to help them in their work, by making sure that we do not spread the infection, we do not create problem, we understand their limitation, and we do not attach a stigma upon the healthcare professionals that they are the carriers of the disease. They are not the carriers of the disease, rather they are fighting the disease. They are the frontline soldiers fighting this battle against the COVID-19 pandemic, and we must all extend our support to them. So these were all the key points mentioned in the editorial. Now let us look at the key concepts. In the concepts to learn section, today we'll look at the Epidemic Diseases Act 1897 and the status of healthcare in India. To counter the spread of this bubonic plague, it was enacted by the colonial rulers. And this bubonic plague is also known as Black Death. It is a very serious bacterial infection and it is spread by a bacteria called Yersinia pestis. So this is important and we should be knowing this. So this Epidemic Diseases Act 1897 is being used by almost all the state governments and also by the center to take certain important measures, because it allows temporary provisions or regulations to be made and which have to be observed by the public to tackle or prevent the outbreak of a disease. This law provides for penalty also under section 3. Any person disobeying any regulation or order made under this act shall be deemed to have committed an offence punishable under section 188 of the Indian Penal Code. Now section 188 has been in news, so it is also important from prelims point of view. We should be knowing that what this section is. So it basically means disobedience to an order which has been duly promulgated by a public servant. This act also provides for protection under section 4, so that no legal proceedings shall lie against any person or for anything done in good faith or intended to be done under this act. So this provides for penalty as well and also for protection of the public servants. Now there have been examples of recent implementation. So in 2018 it was used in Vadodara for controlling a cholera outbreak. In 2015 it was used in Chandigarh to deal with malaria and dengue. In 2009 it was used to tackle the swine flu outbreak in Pune. This Epidemic Diseases Act 1897, this has been in news during this COVID-19 pandemic. But it is not that it has been used for the very first time. This has been used by various state governments for controlling the outbreak of diseases. So the union government has now issued an ordinance to amend the act, which will now treat the violence against the healthcare workers as cognizable and non-bailable. So cognizable and non-bailable means the offences are now being treated under the serious category. It further says that the investigation has to be completed within 30 days and the judgment in such cases have to be given within 1 year. And the accused will attract a punishment ranging from 3 months to 5 years imprisonment and a fine ranging from 50,000 to 2 lakhs rupees. And if the injuries caused to the healthcare professionals are grievous in nature, that means these are serious injuries caused to the healthcare professionals, then the sentence can be more. It can range from 6 months to 7 years in that case, and it will also entail a fine of 1 lakhs to 5 lakhs. So basically, it has made the provisions more stringent to protect the healthcare professionals. But we have to realize that the healthcare professionals have not come under attack just after this COVID-19 pandemic. There have been cases where the doctors, where the other healthcare professionals, they have been attacked by the patients or their attendants for various reasons. Sometimes it has been just the reason that the patient has died and the attendants feel that the doctor is responsible. Whereas the real reason might be that the patient was brought at a very late stage to that hospital. Sometimes there has also been this case of lack of empathy on the side of the doctors in dealing with the patients and their attendants, which has also led to a lot of cases of assault. And there have been reports that certain hospitals have also been thinking about employing bouncers to protect their healthcare professionals, which is a very sad state of affairs if we look at it. Now let us look at the healthcare scene in India. An inadequate availability of healthcare services in both public and private sector, which is common knowledge. Now the serious stats are this, that one government doctor for every 10,189 people, whereas WHO says that there should be one doctor for 1,000 people. And in India, we are having one doctor for 10,189 people. So the ratio is highly skewed. There is one nurse for 483 patients, which means a shortage of around 20 lakh nurses. There are only 8.5 hospital beds per 10,000 people, which is a very dangerous situation. And that is why this lockdown has been imposed, because in the meantime the government is trying to shore up the healthcare facilities, because if the cases rise exponentially, then the Indian healthcare system will collapse. India currently needs twice as many doctors as are available right now, 3 times as many nurses and 4 times as many paramedics. So these stats are very important and they are very useful for answer writing in mains, plus writing an essay on healthcare or health sector in India. Now let us look at India's comparison with other countries. How does India fare? Now the total per capita government spending on healthcare has nearly doubled from rupees 1008 per person in financial year 15 to rupees 1944 in financial year 20, but it is still quite low. Now the total expenditure by the center and states for financial year 20 was 1.29% of GDP, and this is where the problem is. We are spending only 1.29% of GDP on healthcare. And let us look at where it places us when we compare ourselves with the developed world. Now the average for the OECD countries, Organization for Economic Cooperation and Development countries. Now these countries in 2018, they were spending about 8.8% of their GDP on healthcare. So there is a stark difference between what India is spending and what these countries are spending. So India has a lot of catching up to do. We need to seriously increase our healthcare expenditure. So also the IMF has said that India can boost its human capital's productivity by investing in education and healthcare. So education and healthcare remain two major sectors on which the government needs to prioritize its spending. Better education will lead to better healthcare and vice versa. Now in 2018, IMF also identified poor public health as the 12th most important hurdle for ease of doing business. So it is not that public health is only leading to bad health of the people, but it is also a hindrance in ease of doing business. And it has been ranked ahead of crime, tax regulations, and policy instability. So you can look at the importance that healthcare has. So it is high time that the Indian policymakers also realize this and take some corrective actions. So this was all about India's healthcare scenario. So today's editorial is very important because it deals with the healthcare sector and the problems faced by healthcare professionals. And this can be asked in mains as a question where you are asked to discuss about the challenges being faced by the healthcare professionals in India. And this can be in relation to the COVID-19 pandemic or in general what are the challenges faced by healthcare professionals. While attempting an answer like that, maybe you can use a diagram like this where you identify that there are professional challenges, there are personal challenges, and there are social challenges being faced by the healthcare professionals. And in professional challenge, you can talk about the lack of masks, gloves, and PPEs which are being faced by the frontline healthcare professionals. And there is always this risk of infection when they are fighting this COVID-19 pandemic. And there is also a risk of assault by patients and their attendants while they are trying to collect samples, while they are trying to treat the patients, while they are trying to keep the patients in isolation. So these risks are on the professional front. And on the personal front, they have this risk of infecting the family members. So many doctors we have seen that they have stopped going to their homes. And most importantly, the social factor where some kind of stigma is being attached to these healthcare professionals. They are being seen as carriers of this infection, though they are trying to fight it. Now, landlords are asking them to vacate the premises because they feel that they will bring the infection with them. And there have been reports of police excesses. So such kind of things lowers the morale of healthcare professionals. So this was all about today's editorial analysis. See you next time with another editorial. Thank you.